Hello, everyone, and welcome. Well, first of all, thanks for this opportunity, and also thanks to you all for taking the time to attend this session today. My name is Pizzuti, and I am going to briefly present to you my PhD research project using electronic health data to design personalized CME programs for Australasian medical practitioners. First of all, I would like to introduce to you the whole research team. There is me, of course, and then my 3 supervisors. Choosing academic and industry experts and a clinician and educator as my supervisors is directly linked to the fact that my PhD project is embedded in a bigger research program led by the Digital Health CRC and supported by several academic and industry partners. In particular, my project is part of the Practice Analytics research program. Practice analytics is an emerging field that investigates the potential secondary use of existing electronic health data for performance feedback and practice improvement purposes. Among all the different aspects currently investigated within the program, my PhD project focuses on the attitudes and behaviors of medical practitioners, together with the organizational and feedback culture in their workplace, and the use of electronic health data for CPD and CME purposes. Considering this background information, the aims of my research project would be summarized in a few points. Number 1, understand how to use electronic health data for personalized performance feedback. Number 2, investigate how to use this data to inform the design of CME programs. And number 3, explore how to use this data to strengthen CPD for medical practitioners. Before we focus on the details of the project, I would like to clarify why we are conducting this piece of research. The ultimate goal of this project is to support medical practitioners improve their practice and provide safer care. The research team has decided to focus on CPD requirements, the use of data analytics, and CME programs as factors, among other factors, of course, that can actually have an influence on practice improvement processes. Considering the complexity of such piece of research, the team has decided to use concurrently 3 different conceptual frameworks to inform the research design of the whole project. And I'm sure that we will have the opportunity to talk about this a little bit more in the Q&A session. Speaking of the research design, you can see it here for the whole research project. And I would like just to give you a couple of tips on how to read the funnel diagram. On your left, you can find the 4 studies I am going to conduct, and on your right, you can find the country level, the participant, and the research methods selected for each study. Considering that this funnel diagram is probably too little to read properly, I am going to explain a little bit better the different project studies, starting with the first one. The first one is a scoping review with a consultation exercise with thought leaders and experts. The first aim of this study is to investigate the concepts of electronic health data, CME, CPD, and also their interrelationships. And of course, the second aim is to actually identify available research evidence on the topic of my research project. The scoping review has been completed, and at the moment we are working on the last stage, stage 5, and also on the consultation exercise with thought leaders and experts. Concurrently, I'm also conducting a comparative analysis, and the aim in this point is for this study is to explore the standpoints, regulations, and processes of medical regulatory bodies around the use of electronic health data for performance feedback, CME, and CPD. In order to do so, I am comparing existing grey literature on the topic in 5 different selected countries, and you can see them here. And also, I am collecting the opinions and insights of selected key informants. Regarding the current stage of the study, I have conducted an environmental scan. That means I have identified the relevant bodies and also collected the relevant documents. And at the moment, I am recruiting and also conducting same-structured interviews. Similarly, the third study, I am going to start it next week. And even in this case, I have conducted an environmental scan, and I will add to that a gap analysis. In this case, I will be working with Australasian medical education providers to understand how they are implementing the recent regulatory changes in CPD requirements here in Australasia, and what kind of challenges they are facing when they need to use electronic health data as a learning need assessment tools. The methods are the same in this case, comparing the grey literature and also conducting semi-structured interviews with key stakeholders. The last study will be a multi-site ethnographic case study. I will be starting it by the end of this year. And in this case, I'm going to investigate the organizational and feedback culture of selected Australian healthcare service organizations. And also I hope to map the processes and procedures employed to use electronic health data for performance feedback, CME and CPD. Being an ethnographic study, of course, I will use participant observation and interviews. This research is in its early stages, but you can ask me about research methods, preliminary findings, and expected outcomes. Thank you so much.